Mixed emotions for kids as they head back to school. Many are excited to see their friends and teachers again, but they're also concerned about the ease of spread of COVID's Delta variant.
So what can we all do to help children navigate through all this and feel safe in class? Joining us this afternoon to help us understand more about this very topic, Dr. John Sharon, the Director of Mental Health for LA County. Dr. Sharon, thank you for joining us.
Thank you. It's great to be here.
Doctor, first, how have you personally seen the pandemic affect the mental health of children?
Well, I mean, the pandemic has had a dramatic impact on everybody, and certainly on kids. There's a lot of fear, anxiety about getting sick, other things that people are losing, including, family members and friends and routines. And there's a lot of confusion. We're all trying to kind of pivot as we learn more information and we get guidance from our public health experts. And, all of these things can just really be disruptive to people's emotional state.
Early on in the pandemic, we did say we're all in this together, and so true when you hear the answers to that last question. Doctor, for so many kids, they're really excited to go back to school because they can finally be around their friends again, but many are also feeling a lot of anxiety about it. So as a parent, how can parents and teachers recognize these feelings, and what can they do to support the child and make them feel okay?
Well, yeah, we would certainly expect that some kids are going to actually be able to roll with, the situation more easily than others. And, there are many signs when people are not doing well. First of all, kids will reach out and they'll ask questions, or they'll simply ask for help. We'll also see changes in behavior and in routines. Things to look for would be changes in patterns of sleep, complaints about pain that really isn't easy to identify why there might be pain, changes in appetite, activity level. These are things that show up in kids. They're expressions of having anxiety, having fear, and being depressed, which is actually a little bit different than what we see in adults. The most important thing is to really, I think, in many ways, normalize those feelings because they're common across the population. And of course, if things are really difficult and to the point where it's exceeding the family and the friends' capacity, we want folks to reach out to us at the Department of Mental Health. We can provide emotional support in real time. We can offer resources. We can help navigate people to individual resources. And we also have a website that's on this little billboard behind me that has a tremendous amount of information, including access to Headspace, which is a meditation app, and a new one that we've just brought on board called I Prevail, which actually provides a type of treatment online with an avatar and has been shown to be very effective and is easy to use, including for kids 13 and older.
Well, doctor, what can children do for themselves to take care of their mental health?
Well, I think, first of all, check in with yourself like you always do. And when there are issues that you're having trouble resolving, talk to your friends, talk to your family, talk to trusted individuals in your life, and even to your teachers. Also, as I had said earlier, embrace routines that you have always had. I mean, going to bed and keeping a consistent sleep pattern is very important, eating well, and certainly getting exercise. And the other thing that I'll say, and I say this all the time, we all need purpose and we need meaning in our daily lives. And I would say to the kids, you are a part of the solution for us going forward and how schools are going to operate. So recognize that your voices, your requests, and your ideas are important. And we as adults and those who are operating these systems need to listen very carefully and empower our kids to give them that sense of purpose that many have lost in the context of a very confusing pandemic.
And I guess that all starts at home, doctor, with just opening up those lines of communication with your children, no matter how young they are, just checking in on them, making sure they're okay, right?
Absolutely. I mean, it's all about eyes and ears within the family, within the community. And at the end of the day, now is the time for us to get the memo. And, we are all interdependent, and we all have to be listening to each other, caring for each other. And I would say that ought to be a silver lining out of this is tighter communities, tighter neighborhoods, tighter families because it is in coming together that we will continue to persevere. And we're going to bring a lot of learned lessons, new ideas, what we call silver linings going into the future.
It takes a village, doesn't it? All right, thank you, Dr. Sharon, for helping us learn more about this very important issue. We really appreciate it.